even tell which hip you've had done, to be honest with you. I'll walk you back down there. One conventional hip and one robotic hip. Can you remember the difference between recovery?
Yeah. So in 2 weeks, or before 2 weeks, I walked to the end of our lane. There's a stream at the bottom, about 100 yards, and in the previous arrangement, I walked with sticks to the bottom of the lane and back again, probably 200 yards, and it nearly finished me off.
That was the old hip, the non-robotic.
2 weeks this time,
Yeah.
I walked down the bottom of the lane and back, and I thought, oh.
You felt well, yeah, the recovery rate. And this is the robotic hip, which was, how long ago was your non-robotic hip?
7 years.
So you're 7 years on as well, aren't you?
Yeah.
So, and the pain was.
Well, in fact, this is the worst, because of both knees and both hips now. This is the worst coming in and the best coming out.
Wow. What, in terms of all the operations you've had?
Oh yeah, yeah.
And you've had both hips and both knees done.
Yeah.
So out of all the operations you had, the most painful joint was your left hip.
Yeah.
And your most successful result and your quickest recovery was your left hip.
This one.
Which is the robotic hip.
Because when I had this one done,
that's incredible.
Mr. O'Dwyer, now retired, he said, well, it's marginal. He said, yeah, you've got some problems here, but it's up to you. And I didn't have any pain in my knee. This time, it was debilitating in the fact that I was really struggling to walk any distance with the hip, and also I was getting this burning pain in my knee. So it was really sort of quite problematic.
Yeah, yeah. That's been a great recovery then.
Oh, so I'm just delighted.
Yeah, good. Oh, well done. That's good news.